Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And today we're going to talk about obsessions, obsessive-compulsive personality disorder, and borderline personality disorder. Now, one of the most challenging aspects of BPD and other disorders as well is obsessions. Now, what is an obsession? So an obsession is an idea or thought that continually preoccupies or kind of intrudes that person's mind. You just can't stop thinking about it. You just obsess about it. It could be an idea, it could be a person, could be fear, could be a concern, could be core content. It could be a lot of things. So what happens is that obviously with that obsession, there's an increase in anxiety, and it's a drive for a lot of impulsive behaviors to lessen the anxiety and discomfort. So obsessions, that covers a lot. So I thought what I would do is put it in the context of obsessive-compulsive personality disorder and how that's related to borderline personality disorder and traits. And I'll also, of course, discuss treatment options as well in the video. And I think that you'll be surprised about how similar obsessive-compulsive personality disorder is to BPD, and where those obsessions, how they're intermixed. So let's get to it. Now, OCPD is not OCD. It's not obsessive-compulsive disorder. Okay? It is similar in the name only. And now they differ in the presence of obsessions and compulsions, which is for OCD. Now, these include like intrusive thoughts, images, or urges, or by repetitive behaviors that are performed in response to those intrusive thoughts to lessen the anxiety and discomfort associated with the obsessions. So OCD, you have the obsessive thoughts, you have the compulsive behaviors that lessen the anxiety associated with the obsessive thoughts. So it could be that you feel dirty, and so my hands are dirty, I can't stand when my hands are dirty, as an example, and so your hands are dirty, and so you wash your hands, you're constantly washing your hands. That would be OCD, and that hand washing interferes with your ability to function. So remember, all disorders have universal socioeconomic dysfunction. Now, OCPD is characterized by excessive perfectionism, rigidity to rules and morals, orderliness, and control to the level that it impacts your functioning. See, very different. So also, though, it's important, it is considered one of the most prevalent personality disorders. It is actually between 2.1 and 7.9% of the general population. Now let's compare that to BPD, which we know is an estimate of 1.6 to 5.9% of the general population. So OCD is much more common, and there's a lot of overlaps. We're going to talk about that in this video, so you really may be surprised. Okay, but let's talk a little more about OCPD, because some folks may not be familiar with it. Now, there's some research evidence that suggests that the presence of some early experiences that are leading to emotional difficulties in those with OCPD is similar to those in other personality disorders, such as child abuse, anger, suicidality, and substance use. Does that sound like another personality disorder that we talk about all the time in my videos? It does, right? And that's where part of this confusion is. And when we talk about obsessions, we need to sort of rule that out. That's why this is a really important video. And here we go. There's more. Now, one study showed that 72% of individuals that are diagnosed with OCPD, they report a history of child abuse, including 36% endorsing sexual abuse and 81% endorsing neglect. Now, doesn't this sound like a lot of supposed precursors to BPD? This is where some of that confusion is, because I think when a lot of mental health providers or primary care physicians or psychiatrists, whoever it may be, that when they hear, okay, well, that you've had an experience of sexual abuse, and maybe you're having rigidity, perfectionism, obsessions, stress and anxiety, and other factors that we're going to talk about in just a second, where do they go? They don't go to cluster C, which is where OCPD is. They go to cluster B. Now, those with OCPD, they have a tendency for a high degree of affectivity. Now, what that means is affectivity, that's anger, emotional dysregulation, and poor emotional expressivity. and neuroticism. Now, they tend to be moody and experience feelings of anxiety, worry, fear, anger, and frustration. Now, when we talk about personality disorders, if I were to say, what personality disorder are we talking about when we talk about negative affectivity and neuroticism? Most people are going to go where? They're going to go, well, that's got to be BPD. It's often confused with OCPD. Now, folks with OCPD tend to harbor and express a lot of anger. And typically you see a lot of rigidity. It's often seen in those with OCPD, and they may represent attempts to manage underlying impulsive aggression. So they're trying to hold everything in because they need this sense of perfectionism, this sense of orderliness, and they have this sense of rigidity that everything has to be just right, it has to be just perfect. I have to have everything just the way that I expect it to be, and if I don't, there's the obsessive part. And if I don't, then that causes a lot of anxiety, which causes a lot of frustration, which adds to a lot of anger. Okay? So they lead this super structured life to maintain control and to manage a lot of that anger tendency that they have. Now, those with OCPD, they also tend to have difficulty accepting their emotions. For example, they may say something like, when I'm upset, I feel angry with myself for feeling that way. They have difficulty with achieving emotional clarity, and they may say something like, I have difficulty making sense out of feelings. They also have difficulty having access to effective emotion regulation strategies. Right? When I'm upset, I believe there is nothing I can do to make myself feel better. Does this sound like a BPD video and description? Yes, but I'm talking about obsessive-compulsive personality disorder, OCPD. So OCPD folks tend to find their emotions unacceptable, confusing, and difficult to manage when they are upset, which can lead to avoidance of emotion that is characteristic in this disorder. Similar to those, this is very similar to those with BPD. OCPD folks report feeling their emotions very strongly, overwhelmed. Now let's talk about BPD. And we'll talk about it in the context of OCPD. Now, in my clients, I see this tendency for obsessions in many of my clients. And we see that this anxiety, we see the same type of anxiety in folks with OCPD. It's very similar. And a lot of folks with BPD and OCPD, they have difficulty with emotional control, rigidity to rules and expectations, unaccepting of their own emotions, responses, or their emotions in general. So there's so much overlap and confusion. So let's just tease this out, just so we can clarify before we talk about the specifics. Now, I want to go back to OCD quickly, obsessive-compulsive disorder, real quickly, before we go on to the differentiation of OCPD and BPD. Now, OCD, in my opinion, I tend to see a lot of reduction in anxiety associated with the obsessions when the maladaptive or even adaptive behavior is performed. So we see that. Now, this does not mean that a person cannot have OCD and BPD, because you can, but you can also have BPD and OCPD. Okay? But I think there's a tendency to misdiagnose individuals with BPD when it is really OCPD. And I think they miss that a lot of those issues and factors are associated with perfectionism, with rigidity. Okay? So we're going to talk more in detail about that distinction now. When we do these studies, we see that they tend to experience stronger and more negative emotions, such as anger, hate, resentment, with greater problems with emotional control that drive maladaptive behaviors more than those with OCPD. So now we're on a bit of a continuum, right? Whereas your OCPD folks have less of a degree of difficulty managing their emotions, whereas your BPD folks have a greater degree of difficulty managing their emotions. So we're talking about sort of this dimensional component, and all personalities and all disorders are on a dimension. They're not categorical, which means that that an apple is an apple is an apple. But we know that an apple isn't an apple isn't an apple. We know that there's Macintosh apples, Granny Smith apples, and all those different, and they're on a dimension just of sweetness, of size and color and shape and all that, just as disorders are. Individuals with OCPD endure strong negative affect, such as anger, and they have difficulty accepting, understanding, and managing their negative affectivity. However, they do report being able to control the expression of these emotions, whereas those with BPD report being unable to keep their impulses in check, to manage those. So what we're talking again is about that degree of difference, but ability to control. We have to tease that out. Now, they both tend to have difficulty completing tasks and concentrating when they're upset. Now, this may be due to tendency to both disorders, to having problems with rumination, fixation, or obsessions, with thoughts and preoccupational thinking, and such as, I can't get it out of my head. I hear that from a lot of my clients, whether they have BPD or OCPD, and a lot of them say, I just can't get it out. I just have to keep thinking about it. I just have to keep thinking about it. So that comes to, if you have these obsessions, if you have that rigidity, that sense of perfectionism. Remember, we don't want to diagnose with these videos. This is to educate, to empower yourself with the knowledge to do things differently. Now, when we talk about treatment, now there is treatment for OCPD, just like there is for BPD. Now, cognitive behavioral therapy, CBT, has been found to be effective, but the focus needs to be on perfectionism, rigidity, orderliness, and not on the confusion with OCD treatment, which is the obsessive, the compulsions, right, and behavior to lessen that anxiety. So it's very different. So the orientation and the focus is very different. So you have to know what you're dealing with. And that's really what these diagnoses are. They're not for self-definition. They are for guiding treatment. Now, DBT, dialectical behavioral therapy, has also been found to be successful with OCPD, just like BPD, but it tends to be modified a little bit. Now, there is a citation that uses DBT for OCPD treatment at the bottom of the comment section, so you can check that out if you want. Now, one aspect was using what's called a chain analysis of the events that lead up to the problematic behaviors and focusing on the feelings, thoughts, and bodily sensations that occur prior to and after a maladaptive behavior. Now, what is a chain analysis? A chain analysis, this is a technique that is designed to help you understand the function of a particular behavior. So during a chain analysis of a particular problem behavior, for example, impulsive behavior, such as deliberate self-harm or an anger outburst. So what you do is you uncover all the factors that led up to that behavior. You work to discover all the links in the chain that ultimately resulted in the problem behavior, to help you figure out all the things that contributed to a problem behavior. See, now that's why in part I like to talk about core content, because what is that driving factor? And then we add that to a chain analysis. We see that we go through these particular aspects, behaviors, thoughts, reasonings that then lead to that ultimate behavior. And as you go through this, you'll find it's very fascinating. There's all kinds of worksheets online and things like that that you and your mental health provider can utilize to learn more about this. There are also workbooks out on DBT that also look at chain analysis, which with a lot of my clients that tend to be on the borderline spectrum, that we also do chain analysis as well, to build their sense of knowledge, to get their sense of knowledge, to give them their sense of empowerment as well. So it helps them to understand how they got to this behavior. What are those driving factors? And I hope that this video was helpful for you, and thank you very much, and subscribe, that'd be great. Thank you. Have a good day. Bye-bye.